Hey everybody, Dr. James Fedich here, your clinic director at Village Family Clinic. I want to explain a little concept for you, health versus symptoms. So people always kind of ask me, why would you get a checkup if you're feeling well? And sometimes you don't feel things when you actually have a problem. So I kind of like to draw this little line chart here for patients a lot of times. And we look at this continuum here, and if we're down here, we all know the doctor's got bad handwriting, so excuse my handwriting, that says health. If you're 100% healthy down here, and you're 0% healthy down here, that would make you dead probably, right? So everybody's somewhere in between 100% and 0%, right? Healthy and dead. And most of us are not 100%, I don't think. We're not perfect. You're not eating everything, every meal perfect and doing everything absolutely perfect. So nobody's really 100. And if you're down here, you're feeling pretty bad. So what I ask people is, if we go in this line, where do you think you're gonna feel pain or feel a symptom? So, if you're 100% healthy, nothing would hurt, right? So if you're 90% healthy, do you think something would hurt? I don't know. How about at 80% or 70%, 60 or 50%? So you're only running at 50% health. So your body's only working half as well as it should be. Do you think it had any symptoms or know about that? Well, the real answer when they did this in studies is 40% when you start feeling symptoms of how well something's working before you feel it. So they actually did this with animals in an experiment to see how well they would do it. And they would close off a nerve tissue and find out when they had symptoms. And basically we found out most of our systems are at about 40%. They would continue to study this in various ways, and that's about average of how things are working. So if we kind of think about it, do you want your heart working at only 50%? So in general, if your heart's working at 50%, you're going to have no symptoms or no, it's not a problem. In fact, since we're talking about hearts, the number one symptom of heart problems in this country is actually death. So the first symptom most people feel is they die. And everybody's had a friend or uncle, somebody seemed fine, everything was fine, and they had a heart attack and died. And that's 40% of the time of a heart problem is that they're just dead. They have no symptoms, they don't know they're dead, and that's the first time they know they have a heart problem. So your body, any particular organ or part of your body can be working at only half of what it's supposed to, and you'll have no idea in general. There's obviously variations, not always 40%, but that's a general rule. Things work till about 40% till you know you have symptoms. So first things first, that's important. That's why we get checkups. That's why you get checkups. That's why we do tests. That's why you go to the chiropractor once a month to make sure you're in shape, because we want to make sure we don't pick up a problem before it is. So that's number one. And also, that means you could be walking through your whole life at 55% functioning and never have a problem, never have symptoms. So people say, I feel good, I don't need to go to the chiropractor or the doctor. Well, you can be at 55% your whole life, and that's all your body's working, and you're feeling fine, because the symptoms don't start till about 40. So that's the part one why we explain this chart to patients. The number two reason is, patients come in here, they've obviously got to be below 40% if they're in pain, right? So even if you're coming in, your back hurts, knee, elbow, whatever it is, best case scenario, you're 35% health or 39. Even if you're 39, you're just below that symptom line, you're 39% healthy. So you come in here for a couple weeks, we'll get you over that 40% hurdle pretty quick. We'll be at 41% healthy, 40% working. So like I say, if your back's hurting you, come in at 39, 2 weeks you're at 41%, you're going to feel better, and you're just say, I feel better, I don't need to come in anymore, but you're sitting right on that line. That's also why the patients that come in, sometimes people, I went to the chiropractor, physical therapist a couple of weeks and the problem's back because you just got over that line, and then life stress, and now we go back below that symptom line. Now unfortunately, too many people kind of live back and forth on this line the whole time. The third reason I explain this chart to people is, of course we want to get you out of pain right away in this office, but we want to get you up here. For one, we want some breathing room so a little setback doesn't put you in pain again, but we want you functioning the best you can. If it was me, I don't want my heart working at 50%, right? You'll be fine, you won't feel any symptoms, but I don't want to walk around with that time bomb. So we don't want to just get you over that symptom line, we want to get you as hard up here as we can. And this morning I saw an 87-year-old, her heart might not work at 100%, but can we get her 95 instead of 100, or get you the most optimal health? So the definition of health in the World Health Index is optimal state of physical, mental, and social well-being. So it doesn't say health isn't not being symptomatic. The official World Health definition is being at your best performance level. So that's what we aim to do here for you. I hope that explains symptom versus health and why we want you at your optimum health to live the best life that you can do.